Recently, our patients have been inundated with media articles about two particular procedures, one being the Brazilian butt lift or fat grafting to the buttocks, and the other being vaginal rejuvenation or vaginal restoration. And the media basically is reporting these as potentially dangerous. The FDA has come out with a report saying that vaginal rejuvenation is possibly unproven. We know that these procedures can be safe and effective. What do we tell our patients, Dr. Dougherty?
So many patients are concerned and interested in the aesthetics of the buttock, so we'll start with that, and want to do a lot of things to improve the shape and volume of the buttock. So fat grafting is clearly, we know that that's such an appropriate and helpful procedure, though there is a significant risk of injury when done inappropriately. And so I think we need to educate our patients to look for the appropriate person to do the procedure, ask appropriate questions, and really know what they're getting themselves into.
Yeah, so you think this procedure actually is safe when done well in the right hands?
Absolutely, absolutely. I think that the plastic surgeons that we only want to take care of our patients, keep them safe, and provide appropriate procedures, and we're only going to do things that are safe and appropriate. And I do think fat grafting to the buttock is an excellent procedure when done on the right patient who has the right expectations and done in the right hands.
Right, well, I just applaud that wholeheartedly, because that's exactly what our society should be doing, which is to put patient safety first. And though this is a procedure that's been done thousands and thousands of times, it's also true that there have been a certain number of complications. And a lot of these things are really technical, but if we can put our best minds together, then we can bring patients the benefit of a procedure, but we can bring the risk profile down to a very, very low level.
And the FDA has really gotten involved with the vaginal rejuvenation procedures, where various energy devices are used to tighten and restore vaginal mucosa. And the FDA said is they're really not satisfied with the data out there that makes that work, and they're sort of frightening patients about that. So what do you think, Dr. Dougherty?
So first of all, I think that rejuvenation of vaginal mucosa is such a fantastic procedure, and patients have amazing responses to that. It's literally transformed women's lives. So I think it's something that we really need to focus on and help our patients make appropriate decisions.
Well, I think it all comes down again to the skill of the people who are doing it and appropriate patient selection. In other words, you don't just do these procedures on everyone who walks in the door. So this is, again, a point to looking for ethical people who are going to do this in the right way for the right patients.
Yeah, I think we can sum up and tell patients that these both Brazilian butt lifting and vaginal rejuvenation procedures can be safe and effective. It's absolutely imperative that they're done for the right patient by the right practitioner, and that patients need to do their due diligence and do their research to make sure they're in good hands so they can have an expected great outcome.
Correct. I agree with you.
Agree 100%.
So thank you very much for that information. Please look for further information, other discussions on the Plastic Surgery channel. Thanks for watching.